Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast.
Hello, everyone. This is Dr. Keith. I'm back for another podcast of Destroying Diabetes. I'd like to thank everyone for supporting us, reaching out to us. Just continue to spread the word about our podcast to friends and family, people that may have type 2 diabetes or loved ones that have type 2 diabetes. And I would like to encourage you to have them subscribe and follow and listen to our podcast. The best thing that you can do is listen to the podcast, download it, whatever on your device, anywhere that you can get the internet, you can listen to our podcast, download it, and listen to your app of your choice. There's several out there. Spotify is probably the main one. Can listen to Apple Podcasts and some of the others main ones that you can listen to for podcasts. So if you don't know how to get access to podcasts, most of the people, especially some of my more senior listeners, you can instruct or have your kids or grandkids, they can get you set up on listening to the podcast. Just tell them you want to listen to Dr. Hersey's Destroying Diabetes podcast and how do I do it? And I'm sure that they can get you set up within a few minutes listening to the podcast. So anywhere that you have an internet connection and listen to podcasts, you're not restricted by geography. You can listen to podcasts anywhere in the world where you have access to the internet. And that's one of the great things about it. I'm still looking for my first listener to email me. The email is in the show notes. It's herseyhelp@gmail.com. Feel free to email me if you have any questions about anything or questions about anything in the podcast, something that you don't understand about the podcast. If there's some topic you would like for me to address in the podcast, I'm always open to that. Even if you're somebody you want to appear on a podcast, or if you know someone that will be a good guest on the podcast, always looking for great guests. I have a couple of great guests lined up coming soon, so stay tuned to the podcast. I want to continue to provide you information. I want this to be a resource to you to deal with type 2 diabetes, especially. So I know I haven't had an episode in a while. Had some big challenges in my life. Biggest one is that pharmacy owner, unfortunately, I had to close my doors. So dealing with that, that's been a big thing that's taken my time that I haven't been able to record a podcast because I'm in the midst of doing that. So I'm just hopeful as elders always say, as one door closes, another one opens. So I'm looking forward to see what the next door opens for me. And I appreciate all of you if you're religious, spiritual type. If you can keep me and my family in your prayer. So this is sort of the first podcast I've done since that. And so it may be kind of choppy. I'm only going to take a few minutes of your time because I'm in the process of, like I said, lining up guests. And hopefully I'll have some good episodes for you coming out soon. I just wanted to kind of touch base with my listeners because I haven't had one for a while. So you don't think that the podcast has ended. No, the podcast has not ended. The podcast will continue on. We will have also in the show notes links where if you want me to work with you, there's two avenues that I'm actively pursuing. The first avenue is as um, I'm available to speak to your group or organization. And so I'm looking for opportunities in that. If you're having those opportunities available. And I said again, just like the podcast, I'm not limited by geography. I'm available to do virtual workshops, virtual um, speeches, and I'm thankful for the opportunities I've already gotten and just look forward to more. So if you want someone like me to speak to your organization, I can do it either in person or virtually. And I'm really open to opportunities virtually right now. So if you want to have someone like me speak to your group or be part of a panel or conduct a workshop about diabetes, I'm more than willing to do that. And like I said, there will be a link in the show notes where you can book me for those things. And also another thing that I'm doing is that doing diabetes coaching. If you know someone, sometimes you may need some help. Diabetes is no joke. And so I know I'm in the type 2 diabetic. Anybody that's followed my story podcast for 20 years, and I know that it can really affect you physically and mentally. And it's a big task to try to deal with. And wouldn't you like to have someone to help you, someone to be alongside of you, to help kind of coach you through health? If you have diabetes, it's out of control. You have the expert, like myself, expertise. Myself, someone that's been type 2 diabetic for 20 years, someone that's been a pharmacist for 20 years, someone that's been in healthcare profession for almost 35 years, 36 years. To have someone to help you with that, everyone can need assistance. I need assistance with things in life. There's no harm in getting help or having someone to assist you. This disease, I said, it's no joke. This is a disease that can take years off your life. This is a disease that can destroy your organs. You can lose your sight, you can lose your kidney, you can lose your feet with it. So you don't want to mess around with this. I mean, you want to get it under control. Even if you want to get to the point where you can moderate it to a point where you may not even need medication. If you need some help in doing that, I can help you. And I am available to help with that as well. So there will be a link in the show note if you want to hire me as a coach. And I love doing it. I really do love doing it. I would love to work with you. So if that's something that that you're thinking of for yourself or a loved one, like I say, your loved one, they don't necessarily have to be in the area. And virtually, that's where I would do the majority of my consults. So you're not limited again by geography. You could be anywhere in the world, as long as you have an internet connection. I can work with you. We can come up with a program together that will be helpful in reducing your type 2 diabetes, get your blood sugars under control. We may get it under control to a point where you can reduce or eliminate your medications, but you need help and guidance in doing that. It's hard to do it alone, but you have the professional expertise of someone that's been a pharmacist for 20 years and type 2 diabetic for that long as well. I just wanted to, like I said, say hello to everyone, just let everybody know what's going on and that I'm still doing the podcast. One of the things I just wanted to talk about a few minutes in conjunction to that is something that I saw a recent study, and I just wanted to talk to it about a few minutes. And there's something that I will hopefully delve in greater detail in future episodes. Hopefully, I can line up some experts, guests to help discuss this with me because I think it's such a interesting and great topic that I don't want to give it short shift. I just want to talk about the study that I saw and give some ideas about it today. And then just, like I said, I will come back around to talk about it because I just think this is very important. It's kind of one of the things that's not really looked at so much when we talk about diabetes. Like we talk a lot of times about the effects of diabetes, especially, like I said, just mentioned a few minutes ago, just like your organs, such as your your heart can affect your kidneys, your eyes, your lower body parts, where like your legs and feet can have issues affected by type 2 diabetes, especially uncontrolled type 2 diabetes. But the area that's not talked about as much, and it's actually been more fascinating studies, the link between type 2 diabetes and brain health. They show that a lot of times that there's more and more that we see that's an increased risk. Not saying that is the cause, but there's a correlation between type 2 diabetes and Alzheimer's and cognitive decline and some forms of dementia. I don't think that's a lot of things that's like really talked about. Sometimes people just say, well, these conditions are just a fact of getting old, or they may have a family history. And you do have this genetic link to that and family history. And of course, just aging, you have greater risk. But the link between type 2 diabetes may accelerate, and in this study, what they looked at may accelerate brain aging. And the older your brain is, your brain can actually be older than your chronological age, especially if you have certain health conditions. And type 2 diabetes is being seen to being linked to that. And that's one of the things you want to avoid, because having an aging brain, especially accelerated, that puts you more at risk for those diseases such as Alzheimer's, certain forms of dementia, and cognitive decline. So we want to try to control our diabetes. That's another reason, especially if you're over the age of 50 or above, and then the older that you are, you're more at risk for that. But especially all my Gen Xers and baby boomers out there, you're more at risk. Okay, and this study was done in England. It's from patients from the age of 40 to 70. There's more than 31,000 people. At the beginning of the study, they estimated 43% had pre-diabetes and 4% had type 2 diabetes full-blown, which that's a wide margin. But really what the estimate is that that we do have another 20-30% of the population that is under pre-diabetes and don't even know it or not aware of it. Then that's the most dangerous kind, because these people suffering the effects of diabetes and may blow up into full-blown diabetes, and they're not even aware of it. So their bodies are being harmed and they're not even aware of it. People that at least have been diagnosed with type 2 diabetes, they're aware of it, and they can begin different treatments and medications to help alleviate that. Okay, and so they said that what they found in the study, that the gap between brain age and chronological age increased slightly over time with people with diabetes. But that's like a wow there. That's a wow. And I said you don't want your brain age to be higher than your chronological age. Actually, if you can have your brain age lower than your chronological age, that's ideal. That's the thing of having good health and continue to be sharp. But the thing is that when they did the study with the people, they found these associations between aging brain and type 2 diabetes was less in people that did participate in physical activity, high physical activity, did not smoke and abstain from heavy alcohol drinking. And then they found that people that the gap between brain and chronological age was significantly smaller in the diabetes patients that lived the ultimate lifestyle group. And that was those people, like I said, the ultimate lifestyle group was no smoking, no heavy alcohol, high physical activity. And there's been other studies done, and I think they've been very interesting that I've looked at over time. And the thing that said that the belief is that if things don't change, that we may have over 150 million people in this country that have some form of dementia by 2025. That's amazing, because that would be maybe about a third of the population. And that's unsustainable. That's unsustainable because we know people under those conditions, they have more health challenges. They usually need more personal care because a lot of times they're unable to take care of themselves. So we would need a mass workforce to take care of these people, whether they're in their homes or they're in like retirement villages, or they're in working with, or they're in the healthcare system, it's institutionalized health system, like nursing homes will be the big thing, retirement villages. But you would need people to take care of them. And right now we don't have a big enough generation coming behind us. That's because of just so many different factors. And I don't really need to get into like what the factors, but regardless, there's a smaller generation of people behind us. So who's going to take care of us? The Gen Xers and the baby boomers. I mean, especially the baby boomers that most of the baby boomers now are now like in their 70s and above. So I just wanted to talk about that for a few minutes. You just have to, the thing is that you don't do anything else. You have to find ways to get your blood sugar under control, because if you don't get it under control, you're just going to have a whole lot of problems. You're going to have a whole lot of challenges. And the best thing that you can do, regardless whether you're a pre-diabetic, diabetic, is to have these important lifestyle changes. It's more important than the medication. The medications just treat symptoms, or they may slow the progression of the disease or whatever, but they're not to cure. They just like I said, they're there and they're good, and you need it. If you need that to get your blood sugars under control, to use the medications. But ultimately, the biggest thing that you can do is lifestyle changes. You have to get control of that. You have to get control of that. That means like trying to eat a healthier diet, just including a lot of fruits and vegetables, lean meats. Just try to back away and limit the amount of processed food that you take as possible, that you eat. Please do that. That's one of the biggest things you do. Like I said, like even if you do physical activity, like someone's always told me, you can't out exercise a poor diet. So even if you be doing 30 minutes an hour of physical activity a day, and it may mitigate some of the things, but you're not going to really get your diabetes in check without being in control of your diet. Your diet is the most important thing to do. Like I said, if you had a choice, you should be doing both. But if you have the choice of doing one or the other, I would tell anybody to have control of your diet is even more important than physical activity, even though you should have physical activity and so many benefits to physical activity. Physical activity is very important, especially when you talk about brain health, because you're getting more oxygen, more blood into your brain that helps clear your brain out too as well. of a lot of junk that piles up into our brain. We have a lot of waste in our brain. We don't think about that. That's why the other important thing besides these things, they didn't look at it, the particular study that I looked at, but the sleep is so important. Sleep is necessary for your brain to kind of clear out the gunk and everything out on a daily basis. So if you're not getting good sleep, you're setting yourself up for a lot of inflammatory agents to be in your brain that can affect your brain function, can contribute to this aging of the brain. So you really want to have like a clean diet as much as you can, increase physical activity, and getting a good amount of sleep. And then, of course, the other things, if you don't smoke, don't stop smoking. That's one of the most detrimental things to your health. But in so many areas, and I just focus on diabetes, but so many other areas is that as well. And also heavy alcohol use, like what I think is that varies on what the thing, but I don't know the exact amount because I'm not a drinker myself. But usually, if you're just kind of a general rule of thumb, if you're drinking more than, 1 to 2 drinks, a week, if you have a beer on the weekend, that's not considered heavy alcohol use. But, if you're having a beer every night, or a glass of wine, even though I know there's controversy about whether wine helps and doesn't help. And it may be more healthier than drinking beer or liquor, but it's still alcohol and still can have detrimental effects. So even with the wine, you want to limit that as well. I just wanted to give you some just views about this study. I want to come back to this. Hopefully I can come back. I can bring a health expert, especially like someone dealing with like brain health, and can talk about a little more detail. Because I think this is probably one of the most undercovered aspects of type 2 diabetes and the negative effects on your body is the brain health. And that's something that we're learning more and more about, the link between poor brain health and uncontrolled diabetes. So, and I think that's one that people need to learn more about because that might be something that you can control. I mean, a lot of times the opinion is that there's nothing that can be done, nothing that can be done to moderate. You just get old, you just get dementia, you just have cognitive decline. That's not the case, but there are people that are healthy and their mind is just as sharp or sharper than someone that's a third of their age. So that's not necessarily a thing. That's a thing that we've been kind of brainwashed to, and that's kind of funny to use the word brainwashed to believe that that's inevitable, but it's not. And I would like to invite everybody, please, like if you need help, if you want me to speak to your group, like I said, I can speak in person. I can also do virtually, and virtually, especially, this time of year, I have a lot more opportunities open to speak to groups virtually, and I'll be glad to do that. I'll be glad to do workshops. Like I said, just contact me with the email that I mentioned earlier that's in the show notes. And also, I just invite you. I'm going to put that also into the show notes. I'm going to start a new social media page for people to follow me that enjoy the podcast and follow me as I go along my journey. I'm no different than you. I need to do those things too. I need to increase my physical activity. I need to have a healthier diet for myself as well. I need to do those things. I need to do better with sleep. So I will put the link to my new social media page. It'd probably be like an Instagram or TikTok. I'm not sure. I have to talk to my son. He's the expert on it. And so thank you again for your support. And I just wish you just continue your thing and just pray for me as I journey into the next stage of my life and my career. And any kind of support that you can provide, if there's any opportunities you could pass along, I'm open to that. If you have opportunity, if you know someone, please forward my information to them. And I really, my passion for type 2 diabetes and controlling that's never going to change regardless. So thank you again. I hope that you continue to be aware and be well.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.